Hi everyone, Win Brown here with our bi-weekly President's Weekly Video Update. I have Jon Marcinkiewicz with me again. This is your second time co-hosting with me,
yes.
so it's fabulous. And we've just got a few things we want to chat about today to keep you up to date on what's going on around the health system. But before we start, maybe Jon, not everybody, almost everybody knows you, but maybe just a little thumbnail sketch of who you are and what you do, or what you don't do.
Like Win said, my name is Jon Marcinkiewicz, and I'm on my 35th year here at Haywood Hospital.
Wow.
So it's a place that's near and dear to my heart. And I know that Win is going to talk about the engagement survey a bit today, and I'm really hoping that I've been, over the past couple of years, putting a lot of work into upcoming for this engagement survey and helping with staff morale around here. So I'm really looking forward to a good survey this year.
So am I.
So I work in the partial hospitalization program. I'm a therapist there. It's across the street in the Damon building. And I've been working in that program for the past 6 years, and we're quite a robust outpatient psychiatric program that's grown leaps and bounds. We have a full-time psychiatrist who's awesome, Dr. Knoll, and a wonderful staff, and we have great patient outcomes.
That program has grown. If we need bigger and better space for that program,
Yes.
we'll figure that out along the way.
Yep.
It's so widely used and popular and
Yep.
successful.
Yep. And I love going to work every day. It's a great place to work.
Well, I love going to work every day, usually almost every day. And today, like today, we had town meeting today. Maybe we want to talk a little bit about town meeting.
Yeah, so tell me about town meeting.
So, every year we have town meeting, at least every year since I've been here, 9 years. And typically we've done them in January.
And I've been to every one, by the way.
Thank you for coming. But we decided this year that really our fiscal year starts October 1. And so even though like the calendar year starts, and we usually do them in January and then February, we're actually a quarter of the way through the year already. So we decided that maybe we should front load it, come in earlier in the year with some of them. We have more to schedule. Then everybody kind of has the sense of what we're focusing on based on our fiscal year and whatnot. So that's why we kicked them off early. We had the first two this morning. I appreciate everybody who came to what I would call the dry run. They're unrehearsed. We have a slide deck that we put together. We have conversation, but you never know how it's going to go till you get up in front of everything.
Yep.
And we had two full rooms today, which was great.
Awesome. And I looked at the schedule. It looks like you're running less this year than you have done in years past.
So we are currently scheduled for fewer right now, and one of the things we haven't figured out is we are trying to figure out if we can do a WebEx or a Zoom or talk about Facebook Live, but we probably felt we'd take the whole network down if we did that. So that maybe we can electronically reach people so they don't have to travel to town meeting.
Yeah, I think that would be good.
Maybe catch up with the times a little bit and give people a new platform to see town meeting. The other part is I think once we get it refined a little bit more, maybe we'll video one and put it on the internet so people, just like this.
Like this, yeah.
Can click on this, and this is totally unrehearsed as well.
It is
right?
totally unrehearsed, yes. We're winging it.
We're a one take. This is a one take.
So the engagement survey's coming up. So you tell us a bit about the engagement survey, your thoughts on our employee engagement survey.
So every other year we engage Press Ganey to do an employee engagement or employee satisfaction survey, so we're getting ready for that. And one of the things we're reporting at town meeting is what have we done since the last one, what were the priorities, and talking about, I think, some of the accomplishments, a lot of it advised and or led by the President's Advisory Council, which was created post-survey, and you're a member of that.
Which I'm on, yes.
And that was really the committee that came together to decide the priorities coming out of that, and then to help make those priorities known. And we just kept the committee together, and it morphed into an ongoing President's Advisory Committee. And so we've done some review, and I think we've made some good progress, still more things to do, but I think when people come to town meeting and get a sense of the progress we've made, especially thinking around culture, around our care values, refinement, and most lately when people get to see our always behaviors, heart training. We brought in Quinnipiac University last year for all the management team. We truly have started really reinvesting in our people, and so that's part of the theme. So, and we revisit the year, as you know, at town meeting. So what did we get done?
And I think, from being on the President's Advisory Committee, that in working on this future engagement surveys, we really heard the people. The whole heart program, I'm a heart trainer, is, you know, in response to what you were all saying out there that the hospital needs. So, you know, we put our money and our time where our mouth is, and you know, we were a dedicated heart training staff, and we were passionate about what we did and are still doing, because we were going to be heart sustainers going forward.
Right, well, you're still doing training for all the new orientations, right? So twice a month we still have heart training, and then we're going to kick off heart chats, I think in November, now that everybody's trained, and that is a way to sustain it, so it's not a flavor of the month.
Right.
We did this once. This is sort of a new lifestyle for us.
For us old timers, it's not fish again.
Right, it's not fish again. So that's some of the stuff that we're talking about at town meeting and about the engagement survey, just to refresh people's memory and get some more connection. And also inviting, we got 2 people who asked to join the President's Advisory Council after town meeting today, and that's something that we want to add some new members, as you know, and so if we get some folks that are really engaged, it'll be fantastic.
You mentioned earlier on about end of the fiscal year. What did it look like for Haywood Hospital this year?
So Haywood Hospital and the whole family, you know, we think of the Haywood Healthcare. We had a bottom line, or you know, we budgeted for about a $500,000 bottom line, which really is small considering we're about $175, $180 million organization. We finished the year just shy of 1.5 million. So still a 1% margin, which is pretty tight.
Yeah.
But you know, we fully reinvest our capital. We've done a lot of capital investment, so it's not like we aren't funding and fixing things and replacing equipment. So we've done all of that, and you know, we've come out in a fairly good place. So that is a good thing. It's almost a $4.5 million turnaround from the year before. So that is even more significant.
Yeah, and it's 1% is 1%, but it's a plus 1%.
Exactly. I'll take a +1 anytime.
Yes. So what lies ahead? What are some of the projects that we can look forward to in the upcoming fiscal year?
So I think one of the big projects that we're trying to get in the ground is our surgery center project. We started our taping a little late today. That's how old I am, taping.
Yeah, I would say taping too.
Because I was meeting with Rosanna Penny and Dr. Cocherella to talk about the surgical platform and the work that they're moving forward on that. So that is a big project that we need to advance forward. On this campus, you know, we have some construction that we'll be doing. We need to get Haywood Health Center for Women construction underway. We need to finish the OB project, and since someone in behavioral health, you know, there's a lot of anti-ligature requirements around facilities right now, so GPU and MHU both need some capital investment to make sure that we meet the newest, strictest, most stringent anti-ligature things. We have some aging equipment especially on this campus, in radiology in particular, that we've got to figure out how to tackle. At Athol, we've got to finish up the radiology suite. That's the final piece underway right now for the project, and the continued renovation there. HAMG, we're growing it, and new locations and new specialists. So it's some of it's stuff, physical stuff, and some of it's programmatic things. But you know, we're going to be busy, and we just have to keep charging along. We need to grow. We need to continue moving forward.
Awesome. Well, I'm looking forward to growing our program this fiscal year, and the hospital growing and being strong years going forward. And I thank you for the opportunity to be able to talk with you today.
I appreciate you being my co-host again. You're doing a great job. He's a natural, isn't he? Thank you, everybody.
See me in 2 weeks.
I see you in 2 weeks. I think you were already scheduled. We kind of slid this one in. So enjoy the video. Thank you for everything you're doing to make Haywood one of the best community-owned health systems in America. And we'll talk to you in a couple weeks. Take care.
Take care.